There's been a great push towards cosmetic and the look good, feel goods, the great smiles, which is just the technology in today's dentistry is amazing what we can do to help a person have that beautiful one, just gorgeous smile. But yet by the same token, there is now coming to the forefront much more of an oral systemic. But when I say systemic, the overall body health that we're talking about, how the oral complex and the systemic complex fit together. That's a big issue.
Okay. Is that, you think that has to do with, people being, their diets are changing maybe, or they're not going as regularly as before, or what do you think is causing that?
It has a lot to do with diet. We're sugarholics.
Well, that's true.
I mean, sugar that's the biggest overabused drug in the world today. I mean, it's just phenomenal. And we've seen a major change since the early 1900s when everything began to be sweetened. And so sugar is very conducive to oral infections and problems of that nature. Oral infections lead to all kinds of maladies. The science, emerging science in this area has confirmed that oral health and systemic health are tied very closely together.
Wait. You're using big words there.
Okay.
Systemic, what was that?
The systemic, again, is the overall, your overall general health.
Okay.
And the key word is inflammation. That's an irritation, shall we call it, something that's not quite right in your body. So when a person gets an infection in the mouth or has a toothache, swelling, things of that nature, those toxins that are produced are introduced into the body, and they create other issues. And they've now tied those things together, and we see things such as a connection between heart disease, stroke, diabetes, kidney disease, pregnancy complications, Alzheimer's.
So are you saying all these like heart disease and other things you just spouted off can be caused from someone having gums that are bleeding?
That is true. That is true. bleeding gums. I always tell my patients, blood's our enemy.
Okay, all right.
It really is. If we have bleeding gums, that's introducing infection into our bodies.
Huh.
And that goes into our system.
Because it's like an infection almost, and then
right.
it's leaking into other parts of the body.
And as we get into, the liver will produce what they call C-reactive proteins and other what they call cytokines. Now this gets a little complicated.
Yes, no,
they're bad for us.
Yeah, okay, that's what I'm getting. Okay. I didn't get all the words you said, but I'm surprised because this is something I haven't heard that much about. What I hear a lot about is, that lesson. I know from my firsthand experience being as a self-employed, when you go to get insurance to consider dental health, it's like, here's this add-on.
Okay.
And so you treat it like an add-on. It's like, well, should I get dental insurance or not? It's an extra couple $100 or whatever it is. Yeah, I can't remember the numbers. But I think so a lot of times people start treating it like that, right? Where it's like something we know we should do. We know we should maybe go in every 6 months or once a year or whatever the case. But I know plenty of people, it's been like, oh yeah, it's been like 3 or 4 years. And like, and well, why not? It's like, well, I can't really afford it, or they come up with excuses why they haven't done it. And of course, a lot of people don't like going to the dentist.
That's another big issue. In fact, that's a huge
one. Yeah. So but wow. So the science is now showing that having poor dental health can lead to a lot of other illnesses.
The Reader's Digest last year made a statement that says your dentist may be the most important doctor you may see this year.
Really? Huh.
Because we're very much closely
because most everyone thinks about the smile, right? I just want my teeth looking good. That's why we go to the dentist.
But the infections that we can have in our mouth with gum disease, bad breath, things like that, they indicate that there are problems there. And we need to be closely tied together with physicians and working with them so that we can help people with their overall health.
Okay.
Big issue.
It is a big issue. And so, all right, Well, we're going to be jumping to break here pretty soon. But before we leave, I just want to, when we come back, what I want to, okay, so I got a little bit about your history. You told me, you freaked me out about the dental side of things and what we should be doing. But what I'm kind of curious about is, I want to talk a little bit about the insurance side a little bit and get some of your feedback there, because that's top of mind for a lot of people right now. And so, be sure you tune in when we come back. We're going to be discussing, dental insurance, and I'll tie in a little bit with medical insurance. So it's a big topic right now. This is the Recession Smackdown. Mike Turner, and we'll be right back.
This is the Recession Smackdown with Mike Turner, local business owner and broker of Turner Real Estate Group on News Talk 670 KBOI.
Okay, we're back. It's the new year. This is Mike Turner, and this is the Recession Smackdown. I'm so happy to be here this morning. I got the legendary Dr. Poole, that long-term time dental practitioner in this valley, 30 years.
30 big ones.
Wow. That deserves like a high five, because that's amazing. That's a long time.
It's an amazing feat to stay in business that long.
It is. And
there's a few of us that are there.
Well, as business owners, you definitely get kicked when you're down a little bit sometimes. And so either you roll over and you give up, or you somehow find a way to stand back up and keep moving forward. You
made an interesting point here a little bit. When the economy goes down, people have a tendency to stay away a little bit. Mm-hmm. And dentistry is a preventive type discipline. The better we do at staying on it, the more preventive it can be, and we prevent problems. Just a quick question to you. How many of you used your dental insurance that your employer or that you had purchased for the year and used your benefits? Because if you didn't, you just gave them away. Well, that's true. A lot of times folks get dental insurance through their employer, but they're so busy they don't even think about getting the ball together and getting that for their family. A medical insurance is a little different thing, because you never know when you're going to get sick. But by the same token, dental insurance is, as you mentioned, more like an add-on. It's a benefit that's given to you. It's more of a third-party type situation. The dental insurance market came into being back in about the mid-'60s. And I can remember quoting some statistics that they said that in Hollywood, California, you could get a gold crown for just a little over $100. A gold crown in Hollywood today is probably $2,500 to $3,000. Probably, yeah. And yet in the 40 years, I guess now, that dental insurance, that dental insurance has been around, they haven't raised the rates. They'd give them $1,000 maximum benefit. We still have all kinds of policies today that are still at $1,000, where the going price for a crown nowadays is $800 to $1,000 in the Treasure Valley area. And so that makes it a little bit tougher. We're just beginning to see now where companies have upped their benefits. I've had a couple policies now that I've seen quite a few at the $1,500 benefit, some at $2,000, even had one at $2,500 here recently, which is good. But what's your company going to do for your benefits? And when they pay that, you need to use them, because they're valuable to you. Right. I mean, it's not using it. Like you said, you're throwing away. I'm going to jump to a caller. This is a live show, and you can call in, folks. It's 336-3700. We do have someone on the line, so I'm going to see what's going on. Pat, how you doing? Yes, doctor. I would like information about implants. I know when they, first started, I don't know if they were that successful or not. Have they improved over the years? And implants are amazing now. They work so well. It's just... It even amazes me sometimes how well they work. Really? But they've improved the science, the attachment process that goes, the type of coatings that they use on the implants so that they adhere to the bone. They're actually stronger than the roots are anymore. And in my opinion, the most important thing with implants is that they can replace a tooth, literally the root and the tooth, whereas you don't have to cut on other teeth. Or if you're in a denture situation, they establish a retention factor that you can't have, particularly